In terms of my opinion on clinical experiences within international electives, I'm a firm believer that you should understand your boundaries. And so sometimes when you are in other places where the constraints of the healthcare system is large and heavy, you might feel as though you're pressured to perform things that you won't necessarily do on your own in Canada. And I would strongly urge any person that's undergoing an international elective to remain strong with what you feel comfortable doing or what is clinically safe for your given level of training. There are always going to be differences between residency programs, probably within our own country, but also between countries in terms of what is expected for a given level of training. So for instance, if I was to perform a cesarean section as a junior resident in Canada, I would perform that with staff present. Unfortunately, seeing as they have a significant shortage of anesthesiologists, in Uganda that's not necessarily the case. And so from a personal standpoint, when I went to Uganda, I was asked to perform cesarean sections by myself. You'll feel pressure, of course, to want to meet those expectations. I think you need to check yourself, for lack of a better word, and say, is this something that is safe? Am I giving the best care to this patient? And I think, for instance, in my situation, I was able to open up the operating room beside and perform an anesthetic with seemingly someone beside me. And so that way I was able to perform the anesthetic, quote unquote, individually or independently, but also have that backup should I require it. And I think you need to be open to communicating that. You need to be open to communicating if you're feeling uncomfortable, if you're feeling as though you're being pressured, if you're feeling as though you've extended beyond what you're clinically capable of. So I was really fortunate in that the elective that I partook in was in Uganda with staff that had already done previous training in McMaster. So there was already a reciprocal relationship between my current university and the university I was going to. I said, I'm a level 3 resident. This is what I've currently been doing. And I was able to say, that's not something I would do. And I think they were pretty open to that. I still think, though, even if they hadn't have been from McMaster, that if I was to say, I don't feel comfortable with that, I don't think I would have been ostracized, per se.